Hello, welcome to the health clinic today. My name is Alicia, and I'm going to do a health history on you so you can figure out what is going on, okay? Let's start with your name.
RW.
And your male and your date of birth, please.
2/16/93.
And where were you born?
Buffalo, New York.
And your marital status, are you single, married, divorced?
Married.
And your race?
Caucasian.
And your ethnic origin?
Germany.
Who was your previous or referring physician?
Dr. Olson.
And you were seeking care today because?
Abdominal pain and fatigue.
Okay. And your language?
English.
And do you need any communication needs while you're here today?
Mm-mm.
Okay. We're going to start with your past health. Childhood illnesses. Do you remember if you ever had measles, mumps, chickenpox, or polio?
Chickenpox.
Okay. And when was your last tetanus and hepatitis shot?
May of 2011.
And your flu vaccine, did you get one this past season?
Yep. In September.
Of 2013?
Mm-hmm.
Okay. And pneumonia, did you ever get a vaccine for that?
No.
And since you had the chickenpox, you probably haven't gotten a chickenpox vaccine. And the MMR, do you remember when you got that?
I don't remember.
Okay. When was your last examination date?
April 24th.
Okay. Any accidents or injuries in the past?
No.
Do you have any medical history or medical problems?
No.
Okay. Have you had any surgeries?
No.
Any other kinds of hospitalizations?
No.
All right. Have you ever had a blood transfusion?
No, I haven't.
And are you taking any medications at this time?
No.
Any allergies to medications that you're aware of?
No.
Okay. Now we're going to move on to the health habits and personal safety. This is just exercise and diet questions. Can you describe what kind of exercise you do? Do you do mild exercise, occasional exercise, or regular exercise?
Just regular.
Regular. So you work out about four times a week for about 30 minutes?
Mm-hmm.
Okay. Are you on a diet at this time?
No.
All right. And if you were to estimate how many meals a day you eat?
Probably 4.
4 meals? Okay. And your salt intake, is it high, medium, low?
I'd say medium.
And your fat intake?
Probably medium tea.
Okay. Caffeine, do you drink caffeine, coffee, tea, Coke?
Coffee and tea.
All right. And how many cups of coffee do you think you have a day?
1. Tea every so often.
Okay. And do you drink alcohol?
Yeah.
Okay. What kind of alcohol do you drink?
Usually just beer.
Okay. How many drinks a week would you say?
Maybe like 5 a month.
A month. Okay. So it's more of just social drinking?
Mm-hmm.
Okay. Are you concerned about the amount of alcohol you drink?
No.
Have you ever considered stopping drinking?
Mm-mm.
Have you ever experienced blackouts?
No.
Are you prone to binge drinking?
No.
Do you drive after drinking?
No.
All right. Do you use tobacco products?
No.
No. So you don't use cigarettes, you don't chew, you don't pipe, cigars, none of that stuff?
Mm-mm.
Okay. Drugs. Are you currently using recreational street drugs, or have you ever injected yourself with a needle for street drugs?
No.
Right. Are you sexually active?
Yeah.
If yes, are you trying to get pregnant?
My wife's pregnant.
Okay. Congratulations.
Thanks.
Any discomfort with intercourse?
No.
Do you have any illnesses related to HIV, such as AIDS? No.
No.
Do you live alone?
No.
Do you have frequent falls?
No.
No. Do you have an advance directive or a living will?
No.
No. Would you like information on advance directive and how to prepare those?
No thanks.
Okay. Do you have any vision or hearing loss?
No.
No. Physical or mental abuse? We notice that it's a major public health issue in this country. Do you have any issues with that we need to discuss?
No.
Okay. Now we're going to move on to your family health history. If you can just answer these questions the best you know. How old is your father?
50.
And does he have any significant health problems?
Just back pain.
Okay. And what about your mother?
She's 47. She doesn't have anything.
No history. Okay. Do you have any siblings?
1 sister.
And how old is she?
She's 24.
Okay. And any health histories?
No.
Nope. And do you have any children that are born?
No.
No. All right. Your grandmother on your mother's side, how old is she?
69.
And any significant health problems?
She had ovarian cancer.
And what about your grandfather on your mother's side?
He passed away.
Okay. And your grandmother on your father's side?
She's 75 and had breast cancer.
Okay. And your grandfather on your father's side?
He's 77 and has diabetes and had a stroke.
Okay. Alrighty, that concludes that part. Let's do your mental health now. Is stress a major problem for you?
No.
Do you feel depressed? No. Do you feel like you have that you panic when you're stressed?
No.
Do you have problems with eating or your appetite?
No.
Do you cry frequently?
No.
Have you ever attempted suicide?
Mm-mm.
Have you ever seriously thought about hurting yourself?
No.
And do you have trouble sleeping?
No.
And have you ever been to a counselor?
No.
Okay, we're about halfway done, almost there. Do you usually get up to urinate in the middle of the night?
No.
Do you feel pain or burning when you urinate?
No.
Any blood in your urine?
No.
Do you feel burning discharge from your penis?
No.
Has the force of urination decreased?
No.
Have you had any kidney, bladder, or prostate infections within the last 12 months?
No.
Do you have any problems emptying your bladder completely?
No.
Any difficulty with erection or ejaculation?
No.
Any testicle pain or swelling?
No.
Any penile sores, lesions, or discharge?
No.
And do you remember the date of your last prostate or rectal exam?
I think it was May 9th.
Okay, of this year?
Yeah.
All right. And do you perform testicular self-examinations on yourself?
No.
Okay. The next part and the last is going to be the review of your systems. I'm just going to ask you some questions about yourself, and you just answer them the best you can. All right? Your skin, your hair, and your head. If you notice anything that's abnormal.
No.
No? What about your eyes, your ears, your nose, your sinuses? Anything that's concerning to you?
No.
All right? Your mouth and your throat. Any sores, lesions?
Mm-mm.
No. Your neck? Nothing. Okay. And what about your breast and under your armpits? Any lymph nodes, swollen?
No.
Nothing. Okay. Your respiratory system. Do you have any issues breathing?
No.
You don't get fatigued when you're running, when you're walking?
No.
No. Cardiovascular. Do you feel like you have high blood pressure? Your heart rate's increased? Do you sweat a lot?
No.
Or everything's fine with your heart?
Mm-hmm.
All right. Peripheral. Do you notice that your skin tone, everything's good? Your pulses are there?
Mm-hmm.
Okay. Gastrointestinal. I know you mentioned earlier you have abdominal pain.
Mm-hmm.
Can you elaborate on that a little bit? What's going on with there?
For about a month now, it just hurts in like the bottom left section of my abdomen. I'd say it's like a 5.
On a scale of 1 to 10, or
Mhm.
0 to 10, it's a 5.
Yeah, usually it's like a 5.
Does it hurt when you touch it, or is it just hurt constant?
No, it hurts when you touch it too.
Okay.
You put pressure on it.
And are you having any nausea or vomiting with that?
Sometimes.
Okay. Is there anything else with your gastrointestinal system that's going on?
No, I just have to go to the bathroom a lot more.
Okay. How many times a day do you think you go to the bathroom?
Anywhere from 8 to 10.
Okay. And is there anything going on with your stool? Do you notice anything wrong with it?
There's blood in it sometimes.
Blood in it. Okay. All right. Anything else in that system?
No.
Okay. Your urinary system. Is there anything going on when you urinate?
It kind of smells bad and it's been a darker color.
Okay. What about your musculoskeletal system?
I lost a lot of weight and I kind of feel tired all the time.
About how much weight do you think you've lost?
Right around 25 to 30 pounds.
Okay. And what about your neurological system? You feel like you're alert. You feel like you're not confused at all.
Mm-hmm.
Okay. And your hematological and endocrine system, is there any issues going on there?
No.
All righty. Well, thank you.